Hi, my name is Elaine Johannes, and I'm an assistant professor and an extension specialist in the School of Family Studies and Human Services here at Kansas State. And I welcome you to this series of videos about community health, formula for effectiveness. I assume since you're watching this tape today that you're a community leader, that you're concerned about the health in your community, such as myself. Sometimes I've been so frustrated. I've been on several committees, task force, dealing with community health issues, from adolescent health, nutrition, obesity, water, the list goes on and on. And I've been on so many committees that have gotten funded, done excellent work, but didn't seem to have results. It's as though there's a black box confronting our communities. And that black box is filled of issues. Again, obesity, water quality, lack of transportation for healthcare services, and I feel sometimes so overwhelmed, and maybe you do too. However, in that black box of community health issues actually resides our formula for effectiveness. Let's take a look. I've discovered that the formula for effectiveness resides in public health. Public health is a field of study and a field of practice that has been in the United States for more than 100 years. Public health has a very specific way of dealing with all of the community health issues that you and I confront. And I'd like to use these boxes as a cue for us to understand how best to approach those community health issues. First, we have our red box. That red box helps us kind of understand we have a problem at hand, but first we need to define it. The definition of the problem, using data, using information, using the stories in the communities we work in, helps us define what that problem is. Next, we have the green box. The green box for public health represents us determining what the root cause of the problem is, us identifying the causes, and thus it helps us focus our work. We're going to talk a little bit more about the focus pretty soon. Inside the green box, though, resides probably what most of us leap to first when we have a problem. The blue box. And the blue box are the interventions, the programs, the strategies that we in the community want to start right away with. Oftentimes this is the easiest thing for us to do. We leap to a solution without knowing what the problem is, what's causing it, the blue box. But we aren't done yet. Inside the blue box resides effectiveness. We have to have a plan. We have to know what that plan is and how to measure the effectiveness of whatever we're going to do. We're going to use data, we're going to use information, we're going to use a logical path that helps us determine whether or not the black box is being changed. In this series that you're going to be able to watch, you're going to see experts talk about each section of the public health approach. In the next module, you're going to be learning more about how to define the problem. What is the data available that helps us look at what the needs are, what the issues are? The experts you'll be listening to include Whitney Lake Thomas. She is a graduate student in the School of Family Studies, and also Jenny Bernard. She has a master's degree in public health, and she is one of the K-State County Extension agents, and she is located in Riley County. Next, you'll be watching a tape about how to define the causes, identify the causes, and you'll be watching some of the work of Dr. Myers-Bowman. Karen is also in our Department of Family Studies, and she helps us understand theory. Now, don't turn me off quite yet. When I say the word theory, oftentimes people kind of zone out, but it's important for us to identify and understand the causes of what the public health problem is. Karen helps us understand the need to focus, to look at how we can intervene without becoming overwhelmed. Consequently, she's going to help us put on different lenses, look at the public health problem in a variety of ways using theory. This box, the green box, will take a little bit more time because we're going to be trying our hands at theory, like she says, playing with it. I invite you to experience the exercises, look at the resources, and get deep into what Karen's going to teach us about theory. Following the green box, there is the module that helps us look at an effective program, the Walk Kansas program. You'll be hearing from the originator of Walk Kansas, Dr. Mike Bradshaw. He is also part of the School of Family Studies, and he and Sherilyn Jackson, who's the Northeast Area Family and Consumer Science Specialist here at K-State, will be talking about why Walk Kansas works. What are the elements, the components of effectiveness? I think you'll enjoy this one especially. We aren't done yet though. The following module after Walk Kansas is effectiveness. The effectiveness module encourages us to develop a plan, a logic model, and a design for our work so we can follow it, track it, and make sure that we're effective. Without it, we won't be able to impact the big black box of community health issues. So I want you to continue to log on, look at the modules at your own pace. There's no particular order that you have to follow, but I would encourage you to go through all the boxes, don't ignore any of them, and repeat the modules as you need. Thank you.